You take your medication because you trust it's helping you. And honestly, most people never imagine the thing sitting quietly in their medicine cabinet could slowly begin affecting their memory, their balance, their sleep, or even their independence. But according to growing medical research, that's happening to more older adults than most people realize. And the changes usually happen slowly. So slowly, families often miss the warning signs at first. A little more fatigue, a little more forgetfulness, a little dizziness getting out of bed, trouble sleeping, brain fog, a loss of confidence while walking downstairs. And because these changes happen gradually, many people assume it's simply part of getting older. But sometimes, it isn't. Sometimes, it's the medication. After the age of 70, the body processes medications very differently. The liver slows down, kidney function changes, brain chemistry becomes more sensitive, and medications that once felt completely harmless can suddenly affect the aging body in ways nobody fully expected when the prescription was first written. Today we're talking about 7 common medications many seniors should carefully discuss with their doctors after 70. We'll look at what the research says. We'll talk about the hidden side effects many people never hear about. And we'll discuss why some medications may quietly affect quality of life more than the condition they were originally prescribed to treat. Because after a certain age, good healthcare is not just about adding more years to life. It's about protecting the ability to still feel like yourself inside those years. The first medication surprises many people because millions of adults rely on it every single night. Sleep medications, especially medications like Ambien and certain prescription sleep aids. At first, they feel life-changing. You finally sleep through the night. You stop staring at the ceiling at 2 a.m. You wake up feeling rested again. But here's the part many people never see coming. It's 2:13 in the morning. The hallway is dark. An older man slowly gets out of bed to use the bathroom. His body is still partially sedated. His reaction time is slower. His balance is weaker. And one misstep changes everything. According to research published in the British Medical Journal and recommendations from the American Geriatric Society, long-term sleep medication use in older adults has been linked to increased risks of falls, confusion, memory problems, and nighttime disorientation. And the danger is not always dramatic. Sometimes, it's subtle. Feeling groggy all day, forgetting small things, losing focus during conversations, feeling disconnected from yourself. And many older adults never realize the medication helping them sleep may also be quietly affecting how they live during the day. The second medication category may already be sitting inside your home right now. Benadryl, or medications containing diphenhydramine. For decades, people used it for allergies, itching, colds, and sleep. Most assumed it was harmless because it's sold over the counter. But according to studies published in JAMA Neurology, long-term use of strong anticholinergic medications has been associated with increased cognitive decline and higher dementia risk in older adults. And that finding shocked many researchers, because these medications were never viewed with the same concern as stronger prescription drugs. But aging brains become much more sensitive to medications that affect acetylcholine, one of the brain's most important memory chemicals. And the symptoms often appear quietly. You walk into the kitchen and suddenly can't remember why you went in there. You lose track of conversations halfway through. Simple words disappear for a moment. Names take longer to come back. And many families assume it's simply aging. But sometimes, the real answer is sitting quietly inside the medicine cabinet. The third medication category affects millions of seniors every single day. Acid reflux medications, especially proton pump inhibitors like omeprazole and pantoprazole. Now to be clear, these medications absolutely help many people. For some patients, they are extremely important. But according to research published in the BMJ and multiple gastroenterology studies, long-term use has been associated with increased risks of vitamin deficiencies, bone fractures, kidney problems, and certain infections in older adults. And here's what many people never hear. Some seniors stay on these medications for years, without anyone reevaluating whether they still truly need them. The prescription simply continues, month after month, year after year. Meanwhile, the body may slowly lose magnesium, vitamin B12, and calcium absorption over time. And those deficiencies can quietly affect balance, nerve function, bone strength, and energy levels. An older adult begins feeling weaker, more tired, more unsteady while walking, and rarely does anyone immediately suspect the small pill taken every morning. The fourth medication category is deeply emotional for many families. Anti-anxiety medications, especially Xanax, Ativan, and Valium. These medications can absolutely help people during severe anxiety or panic. But according to the American Geriatric Society and multiple studies on aging populations, long-term benzodiazepine use has been linked to increased fall risk, daytime sedation, cognitive impairment, and dependence in older adults. And here's what makes this especially difficult. Many seniors begin taking these medications during painful chapters of life. After losing a spouse, during loneliness, after retirement, during grief. At first, the medication feels comforting, calming, protective, like emotional relief finally arrived. But over time, the aging brain may begin responding very differently. Slower thinking, poor coordination, confusion, emotional numbness, a feeling that the world has become slightly distant. And because the medication once helped emotionally, many people never stop to question whether it may now be hurting them physically. The fifth medication category may be one of the most quietly dangerous. Strong pain medications, especially opioids. And pain changes people. Chronic pain steals movement, sleep, energy, and quality of life. So this is not about shaming anyone for needing relief. It's about understanding risk. According to the CDC and research published in JAMA Network Open, long-term opioid use in older adults increases risks of falls, sedation, confusion, constipation complications, and accidental overdose. And many older adults slowly become trapped inside a cycle. Pain leads to medication. Medication leads to fatigue. Fatigue reduces movement. Reduced movement weakens muscles and balance. And suddenly, the body becomes even more fragile than before. That's why many geriatric specialists now focus heavily on combining pain management with physical therapy, stretching, walking, strength training, and movement-based recovery whenever possible. Because sometimes, the body needs support more than sedation. The sixth medication category surprises many people. Certain overactive bladder medications. According to studies published in JAMA Internal Medicine, some bladder medications also carry strong anticholinergic effects linked to memory problems and cognitive decline in older adults. And once again, the symptoms often appear slowly. Brain fog, forgetfulness, mental fatigue, confusion, and many people never connect the dots. They simply assume aging is accelerating naturally. But sometimes, the medication itself deserves a second look. The final medication category may be the most misunderstood. Certain diabetes medications, especially medications that can increase the risk of dangerously low blood sugar episodes in older adults. According to the American Diabetes Association, severe low blood sugar after 70 can increase risks of falls, fainting, hospitalization, cardiovascular stress, and dangerous confusion. And this is where medicine becomes more nuanced later in life. Because aggressively pushing blood sugar too low is not always safer for older adults. In some cases, moderate stability is healthier than aggressive control. That's why individualized care matters so much after 70. Because medicine should not only focus on numbers, it should focus on the person living behind those numbers. Their mobility, their independence, their sleep, their confidence while walking, their memory, their ability to continue enjoying ordinary life safely and clearly. And this part is extremely important. Never stop a medication suddenly without speaking to your doctor first. Many medications require careful supervision and gradual adjustment. The goal here is not fear. It's awareness. It's asking better questions. Because some of the healthiest older adults are not the people taking the most medications. They're often the people regularly reviewing those medications carefully with trusted healthcare providers, especially after falls, hospitalizations, memory changes, fatigue, or major lifestyle changes. And before you leave, I'd really like to hear from you. Have you or someone you love ever experienced side effects from a medication that nobody recognized right away? Share your experience in the comments below. And your story may genuinely help someone else ask better questions about their own health. And if you found this video helpful, subscribe and join our community. Every week we explore the latest research on healthy aging, memory, mobility, medications, sleep, longevity, and the habits that help adults over 60 stay healthier, and more independent for longer. And in the next video, we're discussing the early warning signs of dementia many older adults mistakenly ignore because they seem so normal at first. Some of those signs are far more subtle than most people realize. Take care of yourself, and I'll see you in the next video.